Hello, my name is Mario Amir Lawson, and welcome to my Equity Problem in Practice presentation titled Veteran Women, Examination of the Utilization of Gender-Specific Physical and Mental Healthcare Services within the VA healthcare system. The problem. There is limited awareness among veteran women in regards to gender-specific services provided by the Veterans Administration, otherwise known as the VA. Also, most of the women screened by VA providers do not receive adequate gender-specific health care at the VA facilities. This review, on the other hand, focuses on 4 areas of importance to veteran women who seek VA medical assistance. Here are the 4 areas. Let's take a look at the literature. Researchers have found that veteran women may suffer from post-traumatic stress disorder for different reasons than veteran men. Yet only 20 to 40% of veteran women utilize VA healthcare programs, and less than 33% of women have been rated for a service-connected disability. The goal of this review is to examine data previously collected by researchers in order to understand the circumstances behind VA attrition rates of veteran women and the reasons behind their limited use of VA provided services, especially for veteran women who have lifetime PTSD and or lifetime depression. Most patients who suffer from PTSD do so for life. However, veteran women tend to also suffer from lifetime depression. So what is the need? The VA has been consistently investing in specialized programs for veterans, although only 4 to 5% of veteran women utilize VA services exclusively. Many of the new programs are gender specific, but the real question is, are these programs deemed important by veteran women? Since program awareness is limited, it is hard to tell without future surveys and observation. We can also examine how some of the most frequently used general services impact veteran women's use of the VA healthcare system. But before I discuss that, I must disclose the limitations of this review. Since almost all of the data collected and reviewed by the previous researchers is from the National Center of Post-Traumatic Stress Disorders and the U.S. Department of Veterans Affairs, this research is fairly limited. Now let's take a look at the VA healthcare system. You see, the VA is nationwide. Yes, the VA serves all 50 states. That means they have facilities in all 48 contiguous states, that's continental states, including Alaska and Hawaii. Those are those detached states. But the VA also serves the US's 5 major territories of Guam, Puerto Rico, American Samoa, the Virgin Islands, and, well, the Philippines, although the Philippines gained their independence in 1946. Now that the geography lesson is over, let's take a look at the treatments provided by the VA. When it comes to treatments, researchers have found that veterans are more likely to have PTSD and depression than civilians, but many go undiagnosed for years. And when it comes to veteran women, about 33% of all veteran women have obtained one or more of these services. You see, PTSD and major depression disorder are at the first 2 on this list. But what do veteran women prefer? You see, veteran women are not monolithic. They do not prioritize the same gender-specific needs. However, there are 6 most frequently used services by all veteran women. Once again, the first 2 are PTSD and depression. 80% of veteran women also prioritize pain management, coping with chronic medical conditions, sleep disturbance, and weight management. According to the research, veteran women are more involved in their mental health care. 98% of veteran women prioritize at least one of the 15 mental health care services provided by the VA. That still doesn't explain why no more than 40% of veteran women utilize VA healthcare services. Let's dive a little deeper here. As I said earlier, the most frequently used services are for the treatment of PTSD and depression, which makes sense because the VA has been developing 2 types of behavioral therapy programs for mental health. One is called prolonged exposure therapy, And the other one is cognitive processing therapy or cognitive behavioral therapy, which they kind of go hand in hand. And they're meant to supplement or replace the use of pharmaceuticals for mental health treatments. These programs are important because prior to Operation Iraqi Freedom, studies were mostly based on veteran men and combat exposure. At that time, no more than 15% of veteran women had served in combat compared to 35% of men. Yet 45% of veteran women would more likely seek VA treatment for mental health compared to 36% of men. By the numbers, there are more veteran men receiving treatment, but more of the overall population of veteran women are seeking mental health support as opposed to veteran men. Military sexual trauma is significant because after Iraqi freedom, it became apparent that combat exposure was not the only reason veterans suffer from PTSD. Combat exposure is still the main cause of the disorder, but many veteran women suffer from military sexual trauma, which also causes and heightens the likelihood of lifetime PTSD and lifetime depression. For instance, rape has the highest risk for PTSD, and rape PTSD can rate higher than PTSD for combat exposure. Military sexual trauma could also be one of the main reasons that the majority of veteran women prefer to acquire services from private healthcare providers. Studies show that veteran women patients have different reasons that they utilize VA services, which depend upon several factors. That includes age, income status, dates of service, distance from the VA facility, quality of VA services, quality of their overall health, time to obtain service, and gender-specific needs, as well as primary care needs. About 23% of veteran women with a service-connected disability say that they use VA healthcare services, and they also have a private healthcare provider. And women who are service-connected are more likely to use VA services. About 70% of those who screened positive for PTSD sought treatment within the last year at a VA facility. This is probably because VA screens every veteran for PTSD and military sexual trauma during their primary care visits. However, many veterans still go undiagnosed. Distance to facilities, quality of care, and misdiagnosis may be why most veteran women acquire non-VA medical care. The result is a VA attrition rate of 30%. That is the rate of those who switch doctors or go doctor shopping. A study in the Journal of General Internal Medicine named these veteran patients attriters. And although there are many factors that lead to the attrition by veteran women, attriters do not continue to use VA healthcare and are less likely to have mental health issues associated with military service. In conclusion, veteran women report not knowing about specific services, receiving a denial for benefits, or they believe that services are costly and inadequate. However, some veteran women do not apply at all. Contrary to popular belief, the majority of service-connected veteran women receive mental health treatment at the VA. And with a variety of services used, more qualitative research is necessary to evaluate why veteran women have a higher chance of being denied for service-connected benefits and are more likely to lose their VA benefits once acquired. It is also important to research why they do not attempt to reapply after being denied. The information gathered in this review is from several peer-reviewed empirical resources, a dissertation, and a smaller literature review. Once again, I'm Mario Amir Lawson. Thanks for watching. Stay safe and stay healthy. If you or someone you know is struggling with depression or thoughts of harming yourself, please contact the Suicide Prevention Hotline at 1-800-273-8255. That's 1-800-273-8255. And if you're a veteran of the military, dial 1-800-273-8255 and press 1. Once again, that's 1-800-273-8255 and press One, remember, you are not alone.